Hi everyone, how does future parents doing? I'm Daisy, a certified birth doula, and my goal is to provide information to future parents while they walk the journey through pregnancy, birth, and postpartum. Now, what is a certified birth doula? It's a trained professional who provides information, physical, and emotional support to future parents before, during, and after birth. Now, doulas have different passions. Aside from being a doula, some are Reiki masters, others are yoga instructors. I have a passion for breastfeeding, and this is why some of my videos are about this topic. But today we're going to talk about some of the side effects of an epidural. An epidural is a combination of a local anesthetic similar to Novocaine and an opiate, typically fentanyl or hydromorphone. Essentially, an epidural numbs the lower half of the mother's body to block the pain from labor and birth. When it comes to its use, an epidural has become the most widely utilized method of managing pain during childbirth. 71% of pregnant women get either an epidural or some type of a spinal anesthesia in the US and Canada. The big question, do narcotics cross the placenta? Well, before 1961, medical science believed that the placenta was a protected barrier between the mother and the baby that blocked the fetus from harmful substances injected by the mother. The truth is, narcotics do cross the placenta and they enter your baby's bloodstream within 30 seconds of being injected. Keep that in mind. When it comes to the side effects of an epidural on babies, some of the studies suggest some of the following: change in heart rate, breathing problems, respiratory distress, baby becomes nervous and jittery, drowsiness, reduced muscle tone, reduced breastfeeding. Other more complicated side effects are birth asphyxia, birth injuries, infections. Babies become less alert after birth, crying more, and having poorer visual skills. Some of the side effects on mommies are urination problems, fever, lower blood pressure. What about potential risks for mommies? Heightened risk of infection, seizures, nerve damage, respiratory problems. Please remember that. So how safe is an epidural? Epidurals are generally considered safe. However, they do present a number of risks and side effects, as you are now aware, which can potentially increase the risk of medical complication for both mom and baby. Keep that in mind. When it comes to the administration of an epidural, I'm giving you a couple of tips that might come in handy if you decide to use one. Early administration of an epidural should be avoided. Try to wait until you are in active labor to request one. And you can also request a low dose epidural. The different results depend on which drug and how much it is used. When it comes to childbirth advocates, there are many that are now questioning the safety of the common drugs given to mamas for pain relief during labor. So then, what can future mamas do? What can you do as a future mama in order to make the best decision? You should get informed by your healthcare providers about the possible side effects and the potential risk of medical complication for both your baby and yourself, so that you can make an informed decision when the times come. This is an interesting and broad topic, so I encourage you, future parents, to look into it furthermore, so that when the time comes, if you decide to use pain relief medications during the birth of your baby, you can make an informed decision. As always, sending you all lots and lots of love.